There's never been a more important time for all clinicians and healthcare leaders to engage with patients on an equal footing. For some time now, I've been linking with patients as equals in my clinical education work, treating patients as equals in the development and delivery of learning for pre- and postgraduate healthcare students. This equality of approach covers every aspect, including involving patients as part of the teaching team and in their remuneration. We work with patients to develop the sessions and review the evaluation on an ongoing basis. So it's always developing in order to be appropriate and effective. It's incredibly rewarding when students give feedback on these sessions, with comments including how important and valuable real-life experiences are to their education, and that they've learned things which will actually influence and even change their clinical practice. Engaging with patients to improve professional education and surgical outcomes is part of the delivery of safe and effective care. With the current backlog of uncompleted tests and procedures as a result of COVID and pressures on the workforce, this is more important than ever. The more informed patients are, the better the outcomes. Sharing everything leads to safer care. We also need to respect patients' health beliefs and the influence this may have on their decisions, following the guidelines on shared decision-making and on adherence. Many patients have multiple illnesses and conditions. This complexity means that providing they are given full information and support from reliable sources, and that this is shared in an appropriate format before, during, and after consultations, the patient will be able to choose the best course of action themselves. Only the patient knows exactly how their condition and illnesses affects them and what matters most to them. So the course of action for the patient cannot be dictated by one single guideline for a condition or treatment. It's about patient-led shared decision-making. We all benefit if this approach is taken. Not only is it the safest approach in terms of outcomes, it's also the most cost-effective approach. You can find out more about submitting your video to the MedLearn educational video series at Medicine Gov.